My name is Jiayi Huang. I'm a professor of radiation oncology at Washington University in St. Louis. I'm the study PI of this upcoming NRG-CC017 trial. It's a randomized phase 3 trial comparing a novel radiation therapy technique called temporally modulated pulse radiation therapy versus standard radiation therapy for MGMT-unmethylated glioblastoma. So this is a phase 3 study essentially testing this novel technique to see if this technique would improve time to neurocognitive decline in patients with glioblastoma. The first question people tend to ask is, well, how do you deliver this radiation therapy? So there will be educational sessions. For example, at this NRG winter meeting, there will be a radiation oncology symposium during the radiation oncology committee at 8 o'clock. We will go over the technique and some of the logistics, how to plan for this technique. Essentially, in a very simple way, is standard radiation therapy deliver 2 gray per day, most commonly. So this type of temporary moderate pulse radiation therapy essentially deliver that one radiation therapy in 10 different pulses with 3-minute break between pulses. And each pulse is 0.2 gray. So that's kind of a very simple way of trying to understand this technique. Some of the most common questions we receive regarding this protocol is that because the treatment by design is longer than the standard treatment. So standard treatment is usually 10 to 15 minutes for glioblastoma. For this treatment, because the 3-minute break is usually about 3 times longer, so about 30 to 40 minutes. So there's always some question about feasibility and the tolerability. So one is this technique has been used probably over 300, probably about 400 patients in both retrospective and prospective trials. It has been shown to be very tolerable even for older patients. We also remind radiation oncology, who try to treat brain tumors for a living, that for brain metastasis, when we do fractional radiosurgery, especially multi-fractional radiosurgery for multiple brain mets, the treatment technique is about 30 to 40 minutes. So this is not really new. The duration of the treatment is not really new for brain tumor patients, and it's very feasible. And so even though it is longer than traditional GBM patients, the duration of treatment is not that long compared to, let's say, brain metastasis or other things we do. The second most common question I probably get for this trial is that as part of the eligibility, only English-speaking and French-speaking patients are eligible. And a common question is why a Spanish-speaking patient is not eligible. The reason is the primary endpoint is neurocognitive decline. We use this validated neurocognitive testing that's been done by many prior NRG trials. Unfortunately, that instrument is not validating Spanish-speaking patients. And to be honest, there was a lot of interest in trying to validate it, but it was just too expensive, and I ended up not able to do that due to funding restrictions. So at least right now, because that's the primary endpoint, the primary objective, we are restricted to French and actually Canadian French and English-speaking patients only. So this is, as you allude to, it's a new technique. So it's pretty exciting to be doing a randomized phase 3 study testing a novel radiation technique. We really have been delivering radiation therapy, pretty much very similarly, for decades. So this is a fundamentally a different way of delivering radiation therapy. There has been a lot of interest on FLASH. You probably have heard FLASH radiation therapy. And so this is almost, I always joke, it's the anti-FLASH, right? It's another spectrum. So the FLASH is when you deliver dose rate at a very, very high dose rate, where here we're basically delivering the parent dose rate at very, very low. And essentially we're trying to modulate the dose rate in 2 different directions. And both have, preclinical and clinical data suggesting they're beneficial. But the nice thing with pulse RT is technologically it's more feasible, where flash RT is not quite prime time. So this is one opportunity for us to test whether this novel technique reducing dose rate can improve the therapeutic ratio and improve care. Beyond testing this technique and some of other potential of this trial is also unique. It's the first, at least, brain tumor glioblastoma study that actually look at frailty. So frail is actually a complex concept. It's not just age, it's not just performance status, it's more complicated. And this, I think, is one of the unique aspects of this study. We will be testing frailty before and after treatment. We can probably get a lot of information about how frailty changes, how frailty affects how patients tolerate chemoradiation therapy. So that will be another thing I think, beyond the primary endpoint, will be quite impactful for clinical practice in the future.